Welcome back to the American College of Surgeons Bulletin Brief from the front line, Surgeons Voices. It's with immense pleasure that I introduce my friend, Dr. David Welsh. Dr. Welsh is from Batesville, Indiana. He is a regent, which is how I first got to know him, as well as on the PAC board, where we both serve together. And he represents two important, large facets of our constituency, as well as being a general surgeon. He is in private practice and practices in a rural area. Welcome, Dr. Welsh.
Thank you, Dr. Wexner. It's great to be with you this morning.
Well, always great to see you. It's been far too long since we've seen each other in person. Can't wait till that happens again. But for the moment, settling for this virtual format, congratulations on your decision to run for state representative in Indiana. So I'd like to kick it off asking you, what gave you that idea?
Thank you for the question. I have been strong in the field of advocacy for a number of years, as you know. I have interacted with local, state, and national elected officials, in some cases acting as a resource for medical policy matters. Because of my strong desire to help with advocacy, there was an opportunity where my elected state representative chose not to go for re-election, and there was an opportunity. For years, I look at things in my area like going out and saving a drowning person in a river. If you do it several times, eventually you want to go upstream and find out why they're falling in. Well, I've given advice to state and national elected officials, and now it's an opportunity for me to run for a position and take that advice directly to the State House.
So let's imagine that we're your constituents. What are some of the things you'd like to accomplish?
One of the most important things would be to improve internet connectivity and stability. If I can get that to this area, it'll help businesses, it'll help schools, it'll help people in the medical field and folks who are first responders. It's a safety issue. Years ago, when I came to this area, cell phones were this really wonderful thing in the city. Unfortunately, you didn't really have that opportunity to use it where I'm at in rural Indiana. We're in that same position now when it comes to internet. There's a few spots, but they're not very stable. So if you have a medical practice that is designed around telehealth and other relying on the internet, you may or may not be able to be operational today. Being an older surgeon, when the internet's gone down and I can't get to my electronic health records, I can at least go to paper till the internet's back up. But some of my colleagues aren't used to that. So improving the internet to the area will help jobs, will help schools, will help medical community.
Fantastic. So what you're doing is far more global than just helping surgeons.
Correct. It's what I found out is everything ties together. If the schools are doing well and they're teaching STEMI courses, those folks are going to be interested in things like medicine. If they're interested in medicine, those folks will more likely come back to the rural area to help us treat the medical problems.
Are there other surgeons or other types of physicians in the Indiana House, or do you be the Lone Ranger?
Well, there's been a number of colleagues that have been in the House. There's a Dr. Tim Brown, who I've known and worked with the State Medical Association, but he's going to retire after this year. But the college will be happy to know another fellow, Dr. Brad Barrett, is currently in the House, the State House, as a House representative from the town of Richmond. And I've worked with him at the state chapter. I've worked with him on advocacy issues. Several years ago, we were able to get Stop the Bleed bill passed through Indiana, and I worked closely with him and Representative Fry, who I asked him to support the bill. He said, how about I sponsor the bill? And working with Representative Fry and Dr. Barrett, we were able to get it passed. So we now have Stop the Bleed kits in all the schools in Indiana.
Congratulations. That's a wonderful success.
Thank you.
Speaking of success, we obviously wish you tremendous success with your campaign and look forward to your election, celebrating your election, and seeing you do great things in the Indiana House. For the vast majority of us who are not going to be running for office, what can we do to advocate to help our patients do? How do we get the message to our elected officials, as you hopefully soon will be one of them?
Well, it's very simple. Reach out to them. They actually want to hear from physicians. They want to hear from surgeons about what their concerns are for their patients. A number of years ago, I've asked folks to elect their elected official, connect with them, offer to be a resource, make sure they know that when they have a complex issue that's in the medical field, they can count on you to get some expertise, to get them resources so they can better understand how to make a better bill. So we can all do a part. I always tell folks, remember, the elected officials work for us. And you would tell anybody working for you, they need to fix this, they need to adjust that. We need to let our elected officials know our thoughts and how we can make things better for our patients.
Well, thanks again for your insights. Thanks for your commitment to advocacy for our patients. And we again wish you tremendous success in your campaign and the upcoming election.
Thank you very much. It's good to see you again.
Likewise.